COVID-19 vaccination centers, with several states reporting shortage of coronavirus vaccines. The number of cases in India has passed Brazil's tally, making it the country with the second highest number of infections in the world. At least 92 countries depend on India for the supply of COVID-19 vaccines. The wave of coronavirus infections is wreaking havoc in India, with health officials reporting 161,736 cases in 24 hours, bringing the number of infections to above 13.6 million. The death toll has risen to over 171,000, and the country now accounts for 1 in every 6 daily new infections worldwide. And through it all, officials report that vaccine supplies have dried up, with at least 5 states reporting severe shortages and urging the federal government to act. The world's largest vaccine producer has only fully vaccinated 14.3 million people, just over 1% of its population of 1.3 billion, according to Johns Hopkins University. To mitigate the crisis, the government and the Serum Institute of India have shifted focus from supplying vaccines to COVAX to prioritize their own citizens at home, leaving over 92 countries, including Kenya, that are currently depending on COVAX facility desperate. On Thursday this week, Kenya's Ministry of Health allayed fears of a vaccine shortage, announcing that the country is expecting some 2.5 million doses next month.
The government, through the Ministry of Health, would like to take this opportunity to inform Kenyans that some 2.5 million doses provided through the COVAX facility are expected in the country in the month of May.
But amid the uncertainty, a section of leaders is urging the government to consider reviewing its inoculation target if the country is to win the war against COVID-19. Getting to South, Member of Parliament Moses Kuria says the economy will only open up if the government inoculates as many people as possible.
It is my appeal to the Minister, to the Cabinet Secretary for Health and the Cabinet Secretary for the National Treasury to set aside 18 billion shillings so that we can be able to vaccinate all Kenyans who are above the age of 18. And because once we do that, it's actually a saving. It's not an expenditure. Because once we do that, we can now comfortably reopen the economy fully without any restriction.
The Ministry of Health this week camped in Kiambu, sensitizing residents on the need to take the jab.
Today here we are the Ngao range, and we're the Ngao in their corporate social responsibility with their partners. They've organized for the vaccination of various security formations that do come here for training.
Have already got their jab because they are in the front line, just like most health workers have taken the jab, because if you don't take the jab as a front line, then how can you be able to tell other people to take the jab?
The country has so far vaccinated up to 651,650 people.